My friends, good afternoon. This is Dr. B. Today, Dr. B, the best doctor in medicine. Over 30 years of experience in medicine. Dr. B knows it all in medicine. And today, Dr. B wants to talk to all men out there, men who are of a certain age, let's say 50 and above, right? Like me, Dr. B is 50 years old, 50 years young, right? Every man of a certain age, advanced age, right, will have sooner or later to decide whether or not he wants to go on testosterone supplementation therapy, also called testosterone replacement therapy, right? As men get older, our testosterone level decreases. More and more every year, right? There's no exception. Every man goes through this natural process of aging, right? For some people it starts earlier, for some people later. Everybody's different. Me, I'm 50 years young. I started to notice a drop in my muscle mass, my sexual drive, right? My endurance, my strength, my ability to work out for a long time, to push heavy weight, blah, 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 to have sex 3 or 4 times in a night, right? By the age of 45, around the age of 45, my testosterone, I have noticed that it starts to decrease. My endurance started to no longer be what it was before. My ability to push heavy weights at the gym decreased a lot. My sexual drive was no longer what it used to be, where I could satisfy my girlfriend 4 or 5 times in a night, right? And my libido, everything, right? So I personally decided to not go on testosterone replacement therapy, right? And there are many different reasons. One of the main reasons is that no scientific study can right now tell us what is the adequate dose of testosterone for a given individual man, right? You know that our prostate is an extremely hormone-sensitive gland. It responds to testosterone. So from the moment we are a teenager and our testicles start to produce testosterone, to the moment we're going to die, our prostate gland keeps responding to this testosterone that our testes produce, right? Although at a lower and lower level, the prostate is still extremely sensitive to testosterone. As we get older, it gets bigger, right? My dad, who is now 80-something, his prostate is big, right? Because all these years, 80-something years of this testosterone influencing the growth of his prostate, right? So you get this problem that you develop what we call benign prostate hyperplasia. And what's the correct dose? What is this so-called low dose or minimum safe dose? No study can tell you that, right? And the other reason is the risk of prostate cancer. Remember, guys, that the longer that prostate gland that we have just in our perineum, right, just under our bladder, the longer that prostate gland is exposed to the influence of testosterone, this hormone that makes us a man, right? Gives us our sexual drive, gives us these muscles and blah, our voice, blah, 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 right? The longer you expose this prostate gland to this testosterone for many, many years and decades, the higher the risk of cancer, prostate cancer, right? And so, and the prostate is not the same gland in in everyone, right? My prostate is different than yours. My prostate is different than the prostate of that black guy. The prostate of that black guy is different than the prostate of that Asian guy. Every race is different, and every person is different, right? Especially as we get older, right? My prostate doesn't have the same hormonal sensitivity right now than it had when I was 20 years old, or when I'm going to be 60 years old, right? In 10 years, I'm going to be 60. My prostate is going to be different, right? It will have a different hormonal sensitivity. So you have these urologists and family doctors and internists who are being pushed by the pharmaceutical industry. Oh, prescribe this medication, testosterone supplementation therapy, and then they advertise it. They tell you, ooh, if you take this, you're going to be young again. You're going to develop muscle mass, and you're going to be able to satisfy your wife or your girlfriend again 5 times in a night, like when you were 20 years old. You're going to have an erection that is hard like a rock. Okay, but what about the risk of prostate hyperplasia, right? The prostate getting big and giving you all these urinary complaints. You can no longer pee, blah, blah, blah. Then you have to have a surgery, albeit done endoscopically or via laparoscopy, right? It's no longer, they don't need to open you like they used to before. They go from your penis and they resect your prostate, right, via your urethra. It's called a TURP. Transurethral resection of the prostate, right? TURP, TURP. Or they can do it by laparoscopy, blah, blah, blah. But there are some complications regarding this testosterone replacement therapy. And of course, there's this big one, that is the risk of cancer. Now, again, they're going to tell you, well, the study from Stanford or freaking other UCSF or I don't know, any other hospital somewhere, Mayo Clinic, right, showed that if you give only this dose, the risk is not going to increase. Okay, but then when you look at all these studies, guys, there's a huge amount of bias in these studies, right? First of all, they were not conducted long enough, right? They were conducted just for a few years because it takes years and decades to find the side effect of all these medication that they give, right? Right now we get the side effect of medication that were prescribed 10, 20 years ago, and the guy is developing dementia because they gave him this medication for anxiety that at that time was really great, and or they give him this medication for depression, and right now the guy has dementia, blah, 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 right? So, and have you noticed, by the way, when you have a medication, have you noticed the older the medication, the longer the list of side effects, right? If you take a medication that is 20 years old, it has 10 times more side effect than a medication that was marketed just 2 or 3 years ago, because the longer the time passes, the more side effects are discovered. So all these studies that have been done on testosterone supplementation therapy in men, they are extremely biased because they are not conducted long enough, because it's a hassle, it takes a lot of time, and it's very expensive to conduct these studies for a long time, many years, right? And in addition, there is a recruitment bias. Their population that are selected are not different population, right? Remember that the prostate of a black man is absolutely different than the prostate gland of an Asian man. That is absolutely different than the prostate of a Latino, especially not just a variation between the races, but also at different ages. So when statisticians look back at these studies, how they were conducted, and what were the characteristics of the populations that were selected to conduct those studies, they find a lot of bias, right? So, for instance, at the Stanford study, they're going to find out that the research was done on men who were above, let's say, 55. The other guy did the study on men that were above 65, right? But these are two different ages, right? There's 10 years different. And everybody knows that the prostate reacts differently at this age than that age. And the other study, for instance, at Harvard, going to be done on the majority of patient white people. Why? Okay, but what about the black population? Well, there wasn't enough black people in that population from which they conducted their study, right? And everybody knows, for instance, that black people are way prone, higher risk of prostate cancer at a younger age and more aggressive histology than people who, for instance, are white or are Asians, right? So that's why Dr. B decided to not take testosterone supplementation therapy, despite the benefit that would be in terms of muscle mass. I will be able to build more muscle when I go to the gym. I go to the gym 2 hours a day, no exception. I do my cardio, then I do lifting weights, blah, blah, blah. So I would get more muscle mass, right? In addition, my sex drive will be higher, which it's okay, right? Instead of having sex 5 times in a night, well, I have sex 1 time in a night or 2 times. What's the big deal, right? I mean, at our age, who cares? I mean, I'm no longer a teenager, right? My life is no longer centered around sex. Oh, sex. Oh, I want this girlfriend. I want that one. Maybe I can have sex with this one. Maybe I can have sex with that one, like when I was a teenager or a young adult, right? So having less of a sex drive, to me, is not a big deal at all, because my life is now no longer like before centered around sex, right? My life, the same way, is no longer centered around food, right? Food is in a little corner of my life, right? Whereas some years ago, food was the center of my life, sex was the center of my life, right? But we changed, thank God. We became more mature, we become more mature, and we change as we get older, and we realize that all this superficial stuff that used to keep us happy and content are no longer worth wasting time and energy on it, right? I mean, obviously, I love sex, blah, 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 like everybody else, but I don't feel the need anymore and the point in spending my entire evening or my entire weekend having sex with a girlfriend, right? What is the point? I mean, I used to have sex all the time. On weekend, my girlfriend would come here and we would have sex, then we take a nap, then we have sex, then we go eat, then we come back, we have sex. The entire night, we wouldn't sleep until midnight, 2 o'clock, have sex constant. I mean, it's crazy when I look back, right? What is the point of all that, right? Now I love to, intellectual work is replacing, right? Is replacing this waste of time and energy, having endless sex with no point. What is the point of all that, right? Now I love to read. I love to get to learn a second language, a third, a fifth, sixth, seventh, fifth. I'm on my 6th language, right? I love to do work on YouTube to teach you guys, blah, blah, blah. So there's so many other things you can do in life than waste your time to constantly looking for girls, looking for women, looking for having sex and blah, 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 right? So I don't mind having a lower sex drive, right? So that's the main reason why I decided to not take testosterone as a supplement. And also, and I forgot to say, I don't mind at all no longer being able to lift heavy weights at the gym, right? Because it's not good for your joints, right? Now that I do not lift anymore huge, heavy, massive weights, my body is lean, nice, muscular, but with no fat. So you can actually see my muscles, my muscle fibers under my skin, right? And I weigh less. I don't have any blood pressure, right? I don't have any abnormal blood pressure. My metabolism is perfect. I sleep good at night, right? I don't need to weigh 200 pounds, 180 pounds, 190 pounds. Oh, look at me. Oh, I'm so big. Oh, look at me. I'm so muscular. Oh, what is the point, right? What is the point? There is no point in all this shit. So I advise and I recommend you to think twice. If you are a man of a certain age, past 50, let's say, like me, or 45, like me, and you decide to go on testosterone replacement therapy, be very careful. Be very careful, because there's this risk of prostate cancer, and no matter what the pharmaceutical industry tells you, no matter what your urologist tells you about that study, that study showed that if you take a low dose, blah, 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 we still don't have enough years of studies and enough background evaluation, and there's so much differences between people, that I would really recommend to postpone it as much as possible. And as I said in one of my videos, there are now some quite 10, 15 years ago came out those SARMs, right? Specific androgen receptor modulators, SARM, right? That are illegal. They are supposed to do the same work as testosterone, stimulate your muscle growth and your libido, blah, 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 but not stimulate the growth of the prostate, not have any side effect for prostate cancer, blah. But they're illegal. They haven't been approved yet by the FDA. We just don't have enough enough years to evaluate the long-term side effect. But if they become available and legal, then I will start taking some, right? But for now, all we have as men, it is to take testosterone supplementation, and personally, again, I decided to not do that, and I'm combining that decision with a keto diet, right? I'm dieting, so I have no body fat, I have no visceral fat, no subcutaneous fat, there's no fat, I have no love handle, I sleep 9 hours a night, I exercise, I do my cardio, my weightlifting, blah, blah, blah. So basically, I don't need to be buffed like when I was 30, 40 years old, right? A big 190, 195, 200 pound. I used to be 200 pounds. My maximum weight was 200 pounds. I was very muscular, but at the same time also fatty, right? Or so big, you build up fat and muscle at the same time. So you like that, right? Oh, buffed up. I don't see the point of all that anymore now that I'm 50, right? What is the point of me being buffed up? And, oh, I'm buffed up. Look at me. Oh, I'm so big. Oh, look at my muscle, my freaking muscle. So what? You got these freaking muscles, and you can squat 300 pounds. So what? And you can bench press 350 pounds. So what? What have you done for mankind? What have you done to help your fellow citizens? What have you done for humanity? Nothing. You just go to the gym, you push all this stupid weight, you're destroying your joints, right? You're wasting all your time buffing up yourself. There's just no point, right? So this is what I had to tell you guys. I love you. I appreciate your viewership. If you have any comments, put them down there. I promise I will get back to you. You all make me so happy, so blessed. I feel blessed. I started this YouTube channel because I got pissed when I saw a few months ago how much misinformation there's on YouTube in medicine. And people like you who don't know anything about medicine, they get fooled. They buy for a ton of money. They pay to buy this fake stuff, fake supplements, this, that, fake treatments. I mean, it's crazy. People get scanned by all these fake stuff that they sell you online, guys. But Dr. B is here to teach you the truth. Dr. B loves you like he loves medicine. I'm not here to sell you any fake stuff, to give you any fake treatments or blah, 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 blah. Not at all. Dr. B will never BS you. And I'm so happy to have you listening to me. It reminds me of the great good old days when I used to teach in classroom, medical students, nursing students, ultrasound students, X-ray students, MRI students. I used to teach medical sciences. And then I had to give up teaching because too busy at the clinic, right, seeing patients. No more time, not time to do everything. But now that I'm on YouTube, my God, it reminds me the good old day, because you guys are my students now. You guys are my classroom. And I love you so much. I love you back. I feel blessed. I feel blessed to be able to teach again, to teach to you, my great students. God willing, I will see you in the next video. If you have any questions or comment, put them down there. It will take time for me to get back to you. I'm so busy and everything, but I promise I will do that. God bless you. Bye-bye.